can you tell us a little bit about yourself?
Yes, my name is Chris Longo. I am a clinical pharmacist. I have my degree is a Doctor of Pharmacy degree. I specialize in hospice management of hospice patients on palliative care. We do a lot of pain management and drug therapy management and drug utilization reviews on patients, and just basically try to make their last days of life as most comfortable as possible for them and their family members.
Okay. First, I'm going to ask you my overall research topic. Do you believe that a gluten and casein-free diet really helps to improve the symptoms of an autistic child?
Do I believe in it? If it works for the person and it helps improve their symptoms of the disorder, then yes. As far as concrete evidence associated with that, I'd have to say no. There's not enough clinical studies out there to indicate to me that this is something that does work and improve the symptoms of autism. I think there needs to be much more research done in this area of study to get a definitive answer on whether this works or not. But it just seems like nowadays, more and more people, especially with a disorder like autism, are looking to alternate forms of medicine to treat the symptoms of the disease and improve the child's functioning status.
What are some alternative medicines that people use?
Right now, one of the main things are the behavioral therapy and the cognitive therapy. Just managing with the child, helping them improve their daily functions. Another important thing is training the parents on how to treat the child properly, how to understand the disease of autism, and help the child get through day-to-day life. But in that instance, that has been proven to work using that behavioral therapy. Working with the child and teaching them how to cope day to day, how to use their surroundings and identify on things properly. And that does work. There is a lot of evidence associated with that in treating autism.
So why do you think that parents thrive over this diet, such as like Jenny McCarthy? Like she showed like in a book that it's proven to work on her autistic child, and he hasn't been able to get rid of autism, but she's been able to manage his autism
it's
better.
Something new. Anything new, anything on the cutting edge of technology, if you will, people are going to try, especially with something.
Researchers will ever declare that the GFC diet, which is gluten and casein diet, will ever be effective? Like, will it ever be proven to work?
There needs to be a lot more research done. Like you said, the study you looked at was a small group study. They need to do extremely large group studies with thousands of patients to generalize to the common population. There needs to be a lot more research done to get a definite answer. This is just an ongoing process, just like anything in medicine. It takes a very long time for researchers to come to conclude on a certain idea or hypothesis that they believe something works. Like I said, it's an ongoing process. So there needs to be a lot more research to be done.
Oh, okay. Now back to my main research question. Are there any pharmaceutical drugs that are gluten-free and casein-free?
The only way to tell, there are little manufacturers out there that make certain over-the-counter products that are deemed to be gluten-free.
What are they? Do you know?
I don't know offhand, but you can easily go on the internet and access which companies make their vitamins or minerals gluten-free. The issue that you run into when you make tablets or capsules in the pharmaceutical world is we use different inert fillers in our capsules and tablets. So we have our active ingredient, which is the drug itself, that exerts its mechanism on the body and helps us whatever it's treating. Then you have fillers in the pill that make up the rest of the pill, and that's where the issue can lie, whether they contain gluten or other inert ingredients where people can have the intolerances to. So the only way to know for sure is you need to go on each individual manufacturer's website or speak to a representative of the company and see which inner ingredients they use in their pills and capsules to get a definite answer.
Okay. What about medication in general? Like, is there any medication that is shown to benefit children with autism spectrum regarding Asperger's, PDD, any type of autism?
Yeah, absolutely. You can, in like you said, the spectrum. There's nothing itself that treats autism but the symptoms that are associated with it. If a child has an attention deficit disorder, we can use medications such as medications in the class of Ritalin or Adderall, which are the most common ones to help treat that. And other medications where, generally the most common form is the overactivity. And we do have medications that are very commonly prescribed for that. So in that sense, those are the medications you kind of think about with autism. But to link a medication to treat the actual disease state of autism, there is none.
Do you think that eventually, down many years from now, there will be something?
It's tough. I mean, I'm sure there's stuff in the pipeline that they're looking at. I mean, just by looking at the casein and gluten-free diets, does that link? Will that improve the symptoms of autism? Researchers are probably looking at different medications that exert different effects on the body through our neurotransmitters in our brain. That's one of the proposed mechanisms of autism disease is something, not quite our neurons firing the correct way, like such as a quote unquote normal person without the disease would work. We don't know enough yet. Researchers do not know enough yet to the autism. We're learning a lot more as the years go on compared to 10 years ago, but there's just no. It's a very tough disease state to get a hold of right now. So we're learning more each day, and maybe hopefully down the road we can develop something that will help children with autism.
What type of vitamins or nutrients do these children lack if they're not having gluten and casein in their diet?
Well, I mean, you start out with a casein, your dairy products, our common thing that we think of when we're growing up is our calcium intake. We need calcium to build bones. So when children that are developing aren't getting this calcium, their skeletal system is not going to be developed to its fullest degree. So that's a big issue. As far as the gluten products, the wheats and those, certain vitamins and minerals, the gluten stuff, the wheats are supposed to be good, for your cholesterol, your good cholesterol and issues like that. I mean, children don't really have that many problems with cholesterol as adults do. But I think your main thing is anytime you restrict a child to a certain diet, you're going to have a lack of certain vitamins that they need to develop with it. But you got to make sure you supplement with those. So as long as they're supplementing with the correct vitamins and minerals.
Do you think that any of the foods we eat in our society have anything to do with the reason why there's so many of today's children being born with autism spectrum?
You can't pinpoint that either. Same thing with foods that supposedly cause more cancer now. Yes, we do use a lot of foods that are processed with different chemicals in it, but there's no evidence to suggest that these foods cause that. It's just not there. Now, another reason why people say, there's just more autism these days is because clinicians have a better understanding of the disease now. They can diagnose it more frequently as opposed to 10, 15, 20 years ago. We didn't know too much about it back then. So how many children had it back then that went undiagnosed compared to now? You don't know. Why is the incidence of, 1 out of every 10 children born with autism? I mean, that's not the exact number, but I'm just throwing numbers out there. It's because we have a better understanding of it, and pediatricians know more about it and are trained more on it, so they can diagnose better.
When a child first starts this diet, is it better to remove gluten and casein at the same time or one at a time?
Well, maybe it's probably a better idea to do one at a time to see, anytime you change a diet in a child, you want to start out really slow, and then you don't want to take away two things right at once fast. The child needs to adjust to it, and their body needs to adjust to it. So it's probably a good idea to do one at a time and see how the child reacts to that.
Oh, okay. If a child's on this diet, is it okay to allow occasional pauses from the diet?
As far as holidays are concerned,
diet holidays.
I mean, you can do it, but if the child has an intolerance to these things and you reintroduce them, then they're going to have problems with it again. To try this diet and then go on a quote-unquote holiday from it and reintroduce these products in the child's diet and see if the child's symptoms get worse, that's what clinical studies are for. That's what they do in those studies, to see if there is that link to these molecules in the diet and improving symptoms of autism.
So, from your own experience, I know you said that you worked in retail previously and that you're at a pharmaceutical company now. Have you had any past experiences with individuals with autism and like the possible medications that they do buy, at like a CVS, or have you ever came in contact with anybody?
The most common classes of medications where children are on with autism would be your your ADHD, which is your attention deficit hyperactivity disorder medications. These children lack focus and ability. So they're generally on a slew of medications in that sense. I've even seen children on antidepressants, which they use. So a child that's very, very hyperactive will be on the class, like the common ones that I'm sure everyone's familiar with is your Ritalin and your Adderall. They'll also add an antidepressant medication on there to help calm the child down even more. So those are the most common ones that you see that are being used more and more in the pediatric population. And for that disorder. But for autism, you treat the symptoms of it. There's nothing to treat the disease, so it depends. When the symptoms arise, that's when the doctor determines what they need to treat.
How do they treat autism spectrum other than, with medications, even though there's not a lot of medications?
Behavior modification is the number one thing you can do for the disorder.
And that's interesting that you said that.
Cognitive therapists, they work. That's been proven to work. That's been proven to improve the functioning of an autistic child greatly. And these cognitive therapists work with these children every single day on just on coping skills, everyday life activities.
Do you think that gluten and casein is often hidden in foods or like food products?
I think it's in pretty much basically all the foods we eat. I don't necessarily think most food manufacturers have to
hide it.
List them in their ingredients if they're in real small amounts. But I would make a pretty good guess that they're in most foods that we consume.
Do they put it in do they put it on the label usually, or?
They should. It depends on what quantities of it are in the food. If they're a very high quantity, they should put it in there. But if it's just trace amounts, I don't believe they're required to list those ingredients. But you should check every nutrition label to see an ingredient label to see what's in the foods. But most foods that are gluten free, it'll be right on the front cover saying, the big X over the gluten free food.
So if a parent came up to you when you were at work and they said, I heard of this gluten and casein diet and I was hoping to try it on, my child, do you think that I should? Or what would you say if a parent
I wouldn't recommend against it. I would, obviously I don't, I'm not an expert on it. I don't know too much about it. But I don't think it could hurt the child as long as the parents still giving the child their required minerals and vitamins, and should definitely consult with the pediatrician and go for regular checkups as well to make sure the child is developing properly. So I wouldn't recommend against it. I would just educate the parent on the proper nutrition, and make sure they get their essential food groups in as well.
So do you have anything else to say about the link between this diet and autism?
It's a very interesting link, but like I said before, it's something that we need to do much more research on. But it's a start.
Just like the link between vaccination and...
Correct. There's no concrete evidence on that either. It's just another option, another avenue that we're looking upon, exploring, to see if there is a link. And that's what we do in medicine. Anytime a coincidence comes up, we have to study it to see if there is a concrete link in the treatment or something. But we need to do much more research and get a better understanding of it.
Okay.
And it's going to take time.
All right. Thank you for your time.